Hey, this is Dr. Tom Rogers at Performance Medicine in the Knoxville location today with our famous, awesome nurse practitioner expert, Robin Riddle.
Hello.
She's been amazing with our practice and has really some interest in some specialty areas, one of which we'll talk about today. As you know, we work a lot with gut health, leaky gut, whatever you want to call it, spastic colon, irritable bowel, constipation, bloating, gas, gut problems. Because what we found through the years is that a lot of these autoimmune diseases that we treat, like rheumatoid arthritis, MS, fibromyalgia, eczema, a lot of skin conditions, a lot of painful conditions, chronic conditions. Actually, if you don't heal the gut, you're not really treating the root cause of the problem.
Exactly.
And in
All health
integrated
comes from the
medicine, that's
gut.
what you want.
Yep.
It's all about the gut. I'll bet 90% of the time when I get a new patient in here with an autoimmune disease, I ask them, well, before we talk about your psoriasis or your rheumatoid arthritis, tell me about your gut. 99% of the time it's terrible. My gut is terrible.
Yeah.
So it all does start in the gut. Would you agree with that?
Absolutely. All health comes from the gut. Your serotonin is created in your gut, so neurotransmitters come from there. Everything reflected on your skin is coming from your gut. Your hormones, that has a piece to do with it. Your thyroid. Everything works better when your gut works well.
I agree 100%. And it's not just what you put in your gut. Again, I still think the most important part of your health is what you put in your mouth. But like we always say, life is not fair. And there's a lot of people that have their microbiome, that good bacteria versus bad bacteria balance is off. And it may be something that they just can't tolerate a certain type of food. I mean, there's certain foods that we try to rebalance the gut with or eliminate so that you can start rebalancing the gut, like sugars and glutens and dairy and
Absolutely.
soy and corn and maybe nightshades. And a lot of times we'll do allergy testing on foods as well. But the thing I want to talk about today, and I want you to expound on because you're the expert, is the GIMAP test that we're doing now. We've done it for a while, but we're really focusing a lot now. They've improved it. It's affordable, and it's really helpful in determining what's going on with your gut. And sometimes it's very surprising. Tell us about this test a little bit, Robin.
So I love the GIMAP. It is a DNA PCR test, so it's very, very accurate, great at picking up everything going on in the gut. It does require stool sample collection. Some people are not big fans of that, but it's totally worth it for the results that we can get from this. And I tell patients all the time, I've done a lot of GI testing, I've treated a lot of gut stuff, so I could probably piece together a plan and try to kind of guess at what's going on with you and maybe get some things better. But really, testing is absolutely the way to go. I know exactly what's going on. I know exactly how to hit it, how to fix it, and how to make everything better. Because there's definitely some things that pop up on there that surprise me on patients at times. So having this test, it looks at your good bacteria, your bad bacteria, the really bad pathogenic bacteria. It's going to look for viruses, protozoa, worms. It's going to look for H. pylori, looks for yeast, and then it looks at some intestinal health markers like zonulin, which helps us diagnose leaky gut. It looks at inflammatory markers in the gut, even looks for inflammation caused by eating gluten. So if we see that antigluten elevated, we know that gluten is a really big trigger that needs to be avoided. So there's so much awesome information that comes from this. I get so excited every time I see one of these come back because it's just such a cool test, and it can make such a difference in people's lives whenever you actually fix whatever it is that they've got going on.
I love that. You know, talking about glutens and that gliadin protein that is a marker in here. How many times have you sent a patient to a gastroenterologist and they, thinking they probably have some gluten sensitivity, and they go, well, the test was negative.
Yeah.
I mean, all the time. Rarely do I get a celiac, full-blown celiac, but
Yeah.
there's a spectrum. So if they tell you, no, you don't have a gluten problem, you still probably do have a gluten problem, don't you?
Well, and so what they're doing in the GI doctors is a blood test. And so this is reflective of what's going on in the gut, not what's going on in the blood. So this looks at it in a different way. And I have personally seen patients who pop positive on this, that their other testing was negative.
Or even had a negative biopsy in their stomach.
Yeah.
I've seen that a lot of times
Yeah.
too. You know, you said that this thing will pick up things that you can kind of guess at, but a lot of times I'm surprised when I look at this. For example, Andy,
Yes.
our physician's assistant, my son, who I've been trying to heal his eczema for a while through a better diet.
Yep.
It just really didn't work. I mean, he tried a lot of different things, but then he got the GIMAP test, which you so kindly went over with him and are treating him now for this. And it showed he does have H. pylori, Klebsiella.
Which I totally didn't expect.
I know.
Based on symptoms talking to him, I would have sworn up, down, and sideways he had candida, would have treated him based on that, would not have gotten him better. He did not have candida. He has H. pylori, which is a trigger for eczema and psoriasis. So he just started his treatment. I'm super excited to show you guys his before and after pictures once we get him all fixed.
That is awesome. I would have guessed candida too because he's a type 1 diabetic.
Exactly.
You know, and H. pylori, I mean, he didn't have the typical peptic symptoms of
No.
an ulcer.
No.
But it was really interesting to look at his microbiome on that thing. And you were spot on with ordering this test for him. I can't wait to look at your treatment protocol, which I've looked at, and it's not going to take long at all to treat him.
No.
And we're going to get some good results. I'm certain of it.
Getting to the root cause. He could put steroid creams on his skin. He could do all kinds of stuff to try to suppress that, or he could treat the root cause.
And it's good to know too, because as we talked about before, H. pylori is a transmissible, contagious disease.
It is. It is.
A lot of people don't know that about guts, but you got to look at that. So the GIMAP test, it's a stool test, but it's easy to collect. You send it in yourself, and then we get the results in probably 2-3 weeks.
2 to 3 weeks, yeah.
And I think I ordered 5 of these tests last week, so I can't wait to go over a lot of the tests with my patients and get your help with it too, since you're the expert. But think about your gut health. If you feel tired, if you have brain fog, if you can't get your hormones right, if you have rashes, you itch, if you have gas, bloating, heartburn, symptoms of IBS, if you've gone to your GI doc and your scopes look normal but you're still not better, you need to look at this test and see if we can help you out with that. Any other words of wisdom, Robin?
Nope.
Today?
Sounds great.
Well, thank you for coming on here today, and I hope you guys will think about this GIMAP test for you or your loved ones if you have symptoms of gut problems or anything autoimmune. If you just don't feel right, think about your gut. So this is Dr. Tom Rogers with Robin Riddle today. Hopefully you'll share this podcast with your friends, and we'll see you next week.